Hi there. You are listening to the Perio Patient Podcast, a podcast for my patients and anyone else who cares to listen. Dr. Ben Young here, and I am a periodontist in private practice here in beautiful San Antonio in the great state of Texas. The title of this podcast, episode number 70, is about LANAP, L-A-N-A-P. For many of you, the acronym LANAP is familiar because you have looked at treatment alternatives already as to how to treat periodontal disease. This podcast today relies on you knowing just a little bit, and I would start you back with my presentation, A Tooth Has Four Parts, which you can see on the homepage of my website, dryoungperiodontics.com, spelled out dryoungperiodontics.com. It runs 15 minutes and explains essentially what periodontal disease is in a way to answer the question for patients, what do you have to know to manage your own care? Periodontal disease, or periodontitis, is a chronic condition, and it requires that you are seen periodically. The video explains where you need to go, at what frequency, and also what to expect when you get to an appointment. Also in that video, I break out periodontal therapy into two treatment categories. The first I call active treatment, and the second I call supportive periodontal therapy or treatment. When someone is in active treatment, it means they have problems that place them in the active disease category, and the objective is to get them as quickly as possible into the health and stability side of a line dividing between disease and health. Again, that's all on that video. Supportive therapy is the ongoing effort to keep people on the health and stability side of the line, and also to monitor and identify if and when someone is having a problem that drops them back into the disease category. Think of it as a flare-up. With all of that as the background in mind, now let's talk about the benefits as well as a limitation or two of LANAP, or laser-assisted new attachment procedure. And this is found in terms of treatment on the active treatment side of care. Now, I understand the term LANAP means something to dentists, this new attachment procedure, but it may not mean that much to you, so we'll get into that in just a moment. First, however, there's a good website for you to know about, and I'll put a link in the description below, and this is lanap.com, LANAP.com. So go there. There's lots of material for you to study or read about. So, what is meant by laser-assisted new attachment procedure? This procedure, which has FDA approval, by the way, has shown through studies that looked at the microscopic changes following treatment that showed not reattachment of soft tissue like a healing process to the roots at the base of pockets, where this disease is actively removing both soft tissues and hard tissues, but something that the histologists call new attachment. What they mean by this is that they were able to see new cementum formation and periodontal fibers were observed above a notched line where there was once a pocket, following the particular laser protocol using a particular laser, the one those of us who were trained in this procedure use. Can other lasers accomplish the same result? Not predictably, for a very specific reason. The word laser is also an acronym and means light amplification by stimulated emission of radiation. Now that's a mouthful, but that's what laser means. Now, by light amplification, it is more than just visible light. It is within the spectrum of energy physicists call electromagnetic radiation. Here is how one online dictionary describes what a laser is. It is a device that generates an intense beam of coherent monochromatic light or other electromagnetic radiation by stimulated emission of photons from excited atoms or molecules. Lasers are used in drilling and cutting, alignment and guidance, and in surgery. The optical properties are exploited in holography, reading barcodes in grocery stores, and in recording and playing compact discs. So, a laser is a monochromatic energy, meaning it has one wavelength. And it all depends on the energy that's going through a crystal, and that crystal then defines what the wavelength is. So this is when it got really interesting for me as I took the courses on lasers. I discovered that the frequency of the energy altered the absorption of the beam into different substances, and that the particular laser used in the equipment I work with is focused specifically on soft tissues as opposed to hard tissues. This is important because it will not, unless misused, you point it directly at something and hold the beam a long time, it won't damage the hard tissues of, say, the cementum, the bone, root substance dentin, and it will not cut into enamel. Other types of lasers can cut through hard tissues. This one does not. What it does do is kill the bacteria that nest in the tissues around the pocket. It also removes dying cells. So it is a narrow beam that penetrates healthy tissues, turns on quiet cells nearby to begin the healing process, and reduces some nerve pain. So the energy from the laser is focused down to run through a flexible fiber optic line about the width of 3 human hairs that works in a wet environment, which is beneficial when you think about saliva and blood being in the field. Those don't affect the beam. And it kills the organisms within the pocket and within the surrounding tissues that are not affected, when they're in their surrounding tissues, that are not affected by the mechanical cleaning methods alone. So beyond scaling and root planing or deep cleaning the roots, the laser penetrates into tissues those do not affect. Think of it this way. Before laser, the treatment of periodontal disease involved 2 basic methods, mechanical and chemical. Mechanical methods involve cleaning roots with hand instruments and ultrasonics, and chemical involving killing organisms with antibiotics, for example, as well as mouthwashes. Because of the nature of this particular disease, we have found that when the destruction is greatest from the disease, we need to use combinations of approaches. One alone isn't enough. This describes the escalation of treatment from what we call non-surgical, meaning deep cleanings, which we also refer to as scaling on the root to remove the calculus or tartar, and root planing the root smooth to remove any toxins that may be there, all the way up to surgical procedures where the soft tissues are mechanically moved away from the roots and bone in a surgical procedure in order to have access and treat bone defects by either contouring the bone or grafting bone back or other materials or combinations of those procedures. All of this requires a large area of soft tissue involvement. meaning a lot of healthy tissues have to be injured in order to access a very focused problem area. When using only mechanical and chemical options, this is often necessary that you involve a lot of tissues. And please do not misunderstand me to be saying the laser substitutes for these other two methods of treatment. It does not. But adding laser to the other two alters the way we can treat this disease, especially initially, when we're working to reduce the inflammatory response. LANAP, by definition, and it is a registered trademarked protocol that is full mouth in nature, changes the other two treatment options, beginning with non-surgical deep cleaning and escalating when indicated to surgical procedures, to then something very different than either one of those. LANAP provides the opportunity to introduce a combination of the three methods of care into one event. Instead of someone coming multiple times to have deep cleanings or scaling and root planing, followed by another examination that then determines where periodontal surgery is now indicated, followed after this by possibly different surgical procedures spaced over multiple appointments, because recovery from full mouth surgery can affect someone's ability to eat food comfortably. So I don't like to do full mouth surgery unless there are compelling medical reasons to do something like that. We can now reduce all of these visits and activities to a few simple visits. So the benefits to this approach, utilizing a laser, are, and I'm going to give you three of them. First, fewer office visits. I think you already know that, but let's go for an example. If I take someone who ultimately needs full mouth surgical care, it can take usually 2 visits for initial scaling and root planing. Why 2? Because many insurance companies will not pay for full mouth scaling and root planing, even by a periodontist. And I do full mouth scaling and root planing all the time. Followed by a re-examination appointment, followed by 2 to 4 surgical procedures. Remember, this example is full mouth surgical care on this kind of an individual. Interspersed between all these surgical procedures, there will be visits for post-surgical care to watch healing and make sure everything is going as it needs to. All combined, this can easily be around 10 appointments or more. And somewhere along the way, dental insurance will likely max out and drop off. My LANAP procedure for a patient with the same problems just described will be 4 visits. And one of these visits may actually be accomplished not by me, but by the dental hygienist in the other dentist's office. All right, benefit number 1, fewer office visits. So number 2, less pain. Because the laser has a biostimulatory effect to the tissue, and because the area affected by the treatment is focused just around the teeth, where the specific problems exist, and because there is usually no suturing involved, the level of discomfort from a laser procedure is similar to having your teeth thoroughly cleaned. There may be a little tenderness following, but most reports I've read and the experience I hear from the patients I treat is that it's not a big deal at all. It's very comfortable. Yes, you are numbed for the procedure, but in my office, most patients do not need to be sedated. All of this goes to the next benefit, which is it's less expensive compared with the classical periodontal approach. However, and this is a biggie, dental insurance does not cover LANAP, laser procedures. For greater than 3 years, I attempted to submit this procedure with the existing and only insurance codes available to me. And what I found was that the insurance companies would routinely deny coverage. Some would, some wouldn't, and it was capricious. Sometimes one company would approve, and then the next week they would disapprove somebody else. You could never predict what they would do. And the concern was that if you pointed it out, rather than providing more money back to the patients, they might rescind money and get it back and say, oh no, we made a mistake. We do not cover this procedure. Some of those companies would send back a statement that said lasers are experimental, and that was the reason they didn't cover it. This is an excuse and frankly untrue, as evidenced by the fact that it is the only FDA-approved procedure I'm aware of in dentistry. Placement of dental implants is not FDA-approved, for example, and I'm not saying it needs to be, but what I am saying is that there was enough evidence for the Food and Drug Administration to approve the LANAP approach to treating periodontal disease. And why was this approval sought? Because systems are entrenched redundant bureaucracies, and research through universities often runs extremely slow. The upside to slow and deliberate in terms of research is public protection. The downside to slow and deliberate research is that new and possibly better approaches can often be overlooked, and sometimes overlooked for decades. It becomes expensive to bring them back. So, lasers are no longer experimental. They haven't been for decades. But some insurance companies have not changed their policies for 20 years and do not plan to. And what is so interesting to me in all of this is that the LANAP procedure resolves periodontitis faster and at lower cost, which would result in a healthier general population. Perhaps insurance companies calculate that more people who would not go through classic periodontal therapy would seek this approach, and this would result in them paying out more in care. Keep in mind, the insurance company is happy when treatment is difficult and slow, because there is a higher likelihood that patients will not go through the hassles of care and therefore will not use the insurance money. So again, LANAP is less expensive compared with conventional care, but not covered by insurance. This resulted in many patients that I treated who expected their insurance company would be at least covering some of the cost. They were disappointed and found themselves having to pay for the care out of their own pockets. Most said it was better than going through the alternative form of therapy, but hey, it was still very frustrating. Finally, I decided that I would do two things because of this. First, I would admit that the insurance companies were not, any time in the future, going to cover LANAP or other laser-assisted procedures, because there are currently no codes available to submit claims, and no one that I know of on either the dental side or the insurance side is pushing for these types of codes to be available. The second thing I decided I would do is I would lower my fees for this procedure. In other words, it's not connected in any way to insurance. And so I no longer have the administrative headaches trying to get the insurance companies to pay for anything having to do with this procedure, because they don't. So I lowered my fees to pass that on to patients. So it's true, if a patient is dead set on having their dental insurance company cover their periodontal therapy to the maximum extent, then they will go the route of more appointments and the rest in some other office, because I'm convinced this is the best treatment available to handle most periodontal cases. On the other hand, if they want the active disease addressed and quickly reversed with greater overall comfort and fewer dental visits, then they will see the benefits of paying this part out of pocket. When they do it this way, then other procedures I provide that are covered by their dental insurance, assuming I'm a provider for that company, will be handled through dental insurance. In addition, it frees up their remaining dental insurance, if they have any, to be used for the other dental care they may need in the comprehensive dentist's office. And also keep in mind, your insurance has a maximum per year. You need to find out what this is in order to know whether or not worrying about dental insurance is really going to play a significant part in your overall dental care requirements in a particular year. Usually, if you need any dental care at all, you're going to max out your dental insurance. Oftentimes, dental insurance covers the basics, assuming you don't need things like crowns and root canals and periodontal treatment. So, finally, let me briefly talk about one I consider a downside hassle, at least when people hear about it at first, having to do with the LANAP procedure. And by the way, if it is not a full mouth procedure, but uses the same protocol, then there are other terms that Millennium Dental Technologies has trademarked and can be used. And one of those is LAR or LAR. I've never heard anybody talk about LAR, but it means laser-assisted regeneration. Frankly, I often use the term osseous regeneration procedure because it's regenerative, and that to me tells me there's a laser involved. Are there other ways to regenerate? Yes, there are. So I'm not making a distinction on that, but I will say lasers are amazing at healing a lot of inflammation. Whatever it is called, whether it is a full mouth procedure or something more localized, I will still ask you to go on a liquid diet for 3 days, followed by a soft, mushy food diet for 7 more days. For a total of 10 days, I'm asking you to modify what you eat. In addition, I will ask you not to brush or floss the treated area. For a full mouth procedure, that is no brushing or flossing at all. For a localized procedure, you can certainly continue routine care in untreated areas. So why this request? Well, it's because the laser during the procedure goes through 2 passes on 2 different settings. The first setting is the bacteria kill setting. This comes before the mechanical cleaning of the roots. The second setting is a blood warming setting. In other words, it is not cautery. It's not burning blood vessels to stop bleeding and in the process killing cells. It causes a more rapid coagulation of the blood in the pocket, which then seals that pocket, preventing bacteria from recolonizing as before. This buys your body time to heal without bacteria involvement. And this is what results in the amazing results we find months later. So, at first, it sounds like a hassle, but on the other hand, it actually results in a more comfortable recovery because you're not mechanically disrupting the gums around the teeth, which causes pain. And you're not opening up the pockets by chewing solid foods or brushing and flossing, which then causes bacteria to go back into these pockets for a total of 10 days. Instead, I will have you on an antibiotic and a mouthwash that will take care of plaque control for you during this time when you're not using the brushing and flossing. Now, sometimes somebody will say, okay, what about if I get spinach stuck between my two front teeth? Well, then gently remove the spinach, but don't touch the gums. Be gentle with the gums, assuming that's the area that was treated. All right. After 10 days, you can return to routine brushing and flossing and be gentle about it and know what you're doing with the floss. In order to do that, you need to read my book. And you can go back to normal foods. At 3 months, you will have a light overall professional cleaning. This can be accomplished by the dental hygienist in the comprehensive dentist's office. After 6 months, I will go in and gently evaluate pockets so we can finally learn what has been the result of this laser-assisted procedure. Let me say, however, that I am well aware of many who are waiting even longer, some up to 18 months before probing. This is certainly a reasonable thing to do for many, but I'm of the opinion that we all need to move into the supportive care phase a little sooner than later following this active procedure we're calling LANAP. I think this is enough for now, but if you're interested in me telling you the results of patients I've treated, take a look at a YouTube video I made where I go over their results before and after. It's quite remarkable. I will have a link to this video in the show notes below. Also, let me encourage you to go back and check out my website if you have not in a while. It has been updated with the podcasts accessible more by topics. For example, this podcast will soon be found under the Periodontal Treatments with Laser Assist tab. This has been the Perio Patient Podcast, and I am still Dr. Ben Young. Thanks as always for listening. If you have questions or comments, please send them to me through the comments section below this episode, wherever you listen to podcasts. And please, if you find this helpful, give it a 5-star review. This is how you help me connect with more people who may benefit from my services. Thank you to all of you who let me know you're listening when you come in for your appointments. I really appreciate it. Have a great day. Bye for now.